But in special circumstances, one may need to check for C, even in younger people. The need to screen, now goes on to the fact that if you are negative, what do? There's a very effective vaccine against B. So if you are negative, then you should, take the opportunity to get vaccinated to prevent being infected. To prevent, the consequences of, having the infection.
Okay, and this vaccine you talked about now is only for hepatitis B we have?
Yes, for B, yes.
And we have, of course, in Nigeria?
Yes, we do.
Okay, so who is eligible to take this vaccine? How long is it going to confer immunity and all of that?
Okay, the WHO says that every infant should have the vaccination at birth, from birth. Although depending on the national programs, some people could start at 6 weeks or earlier. But for those whose mothers are positive for the virus, they should have their vaccination within 12 hours of birth to prevent, because of the close contact between the infected mother and the... But generally, there is a 3-dose vaccine for hepatitis B. The first dose is given either at any point, either 6 weeks, and then the second dose is given 4 to 6 weeks after that, and then the third dose is given about 6 months after the first dose. So there's a 3-dose vaccine that completes the vaccination, and it's about 95% effective in most situations.
And adults, of course?
Yes, adults as well. Everybody, if you are negative, then you should explore the opportunity to get vaccinated to prevent you from having the infection, either from your spouse or from any other person. Okay.
Now, after getting vaccinated, is it a lifelong immunity?
From the current information we have, the tests, people are being followed up in Alaska, in the US, and at least the vaccine has been proven to be effective for at least 15 years. But that doesn't stop individuals, from getting a booster, dose if they think they wish to. The vaccine is quite safe. This is quite important in situations where somebody is in contact with somebody who is positive. If your spouse is positive, for example, it may be worthwhile either checking your immune level or just getting a booster dose periodically. Those in the medical industry too, like doctors and nurses and lab, are also encouraged to make sure that their immune level is always good, because they're always exposed to the vaccine, because of their occupation.
To the virus?
To the virus, because of the occupational hazard, yeah.
Okay, now let's talk, we've said a little bit about hepatitis B and C. Yeah. Let's talk about A and some of the other ones.
Yes, hepatitis A is usually transmitted through water and food, contaminated water and food. Virtually about 90% of us will have had this, those of us who are a bit older will have had this infection from childhood when the water supply was not too safe. But with the improvement in water supply, people are now boiling their water or taking, what do you call it, wrapped, the water in wraps, bottled water, or I've forgotten the name for it.
In the sachet.
A sachet, okay. Water in sachet. The water supply is a bit better now, but although it's not universal. Because if you still go to some people who serve food by the roadside, the source of water is quite, questionable. So for those who eat out, the risk is higher. So for these viruses, the risk in the general population, especially those who don't eat out, is a bit diminishing. So the problem we are having now for A, although we've all been exposed, most of us have been exposed and have developed immunity to it in childhood, we are beginning to have a group of individuals who are growing up to become adults without having been exposed to the virus. And we are beginning to have very severe attacks in adulthood. The attacks tend to be more severe the older you get. So that's also a problem for A. Luckily, there's a vaccine for A. So we have to start to think about vaccinating our children now against hepatitis A because of this generational shift in the presentation and the risk of severe attacks in adulthood. But that's the problem for another day. But the main problem for today is B and C that is actually here with us now.
Okay, so we shouldn't be focusing more on A, but of course it's still around.
No, it's still a problem. I mean, it's something that we should, but I mean, in terms of scale of importance, B and C are more important than
now.
A.
Okay. And for those who have it, let's
Yeah.
talk about the treatment.
Yes.
Is this something that, okay, you've been diagnosed to have hepatitis B and you go for the treatment and you're just fine? Or does it have to do with the lifelong kind of treatment?
Yes, it's an important question you've just asked, because hepatitis B is a very tricky virus. Most times, even when you've treated an individual, there could be a relapse. So the treatment or follow-up has to be lifelong, generally. But it doesn't mean that the person has to be on drugs all the time. But talk on a public health, basis. These drugs are a bit expensive. There are two types, the oral and the injectables. They are quite expensive, and I think our government should draw some lessons from Egypt. Egypt has the highest prevalence of hepatitis C in the world, and Egypt reached an agreement with Roche, which makes the injection that is used to treat hepatitis C, and the hepatitis C is given out free of charge to all persons or individuals who are infected with chronic hepatitis C in Egypt, because the price came down drastically because they could import it in bulk and then repackage it and sell it at to the government at a cheaper price. So it's something we should look at, since we have about 20 million people infected with hepatitis B, and about 5 million of them will die from this disease
if not treated.
I mean, we are much bigger.
On that break, you were still talking about treatment and calling on government to see what they can do in terms of reducing the price and making this work.
Yes, okay, yes. This also applies to the diagnosis. Because the diagnostic tests are actually some modern tests that are a bit expensive as well, which the average person may not be able to afford. So you have people coming in and you let them know they are infected, and they just disappear. Give them the forms to go and do the test, and they don't return to you.
How expensive could it be? What's the range?
Like the test to confirm that somebody actually needs treatment for hepatitis B could cost between 30,000 and 100,000 in some cases.
That's for the test to confirm
that the person...
But the normal one is not so expensive.
No, the screening test is not so expensive. But what's the value of knowing that you have something and then you cannot go further to determine whether you require treatment
but at least
or not?
The first step is to know whether you have.
Yes.
Then we can cross the other bridge when we get there.
But you see, the danger here is that doctors are now beginning to treat people, both those who require treatment and those who don't require treatment, irrespective of, without going on to do the tests that are required. Because if a patient cannot do the test, the patient puts pressure on you. Let me start this treatment. I'm infected, so why do you have to wait to know whether I require the treatment now or later? So we now have indiscriminate treatments, and people are using the wrong...
Which could have its own consequences.
Yeah, people are using the wrong drugs. There's a drug, particularly hepatitis B, called lamivudine, which is no longer being used.
Okay. I think we have a caller. Hello?
Hello, good morning.
Thank you for joining us. Could you turn down the volume of your TV set, please?
Okay.
Thank you.
Yeah. Please, I want to ask the doctor, where can we get tested for hepatitis? Either A, B, or C, maybe. Because is it available to go to general hospital or we go to private hospital? Thank you.
All right, thank you, Belu.
It's available in virtually all laboratories in the town. Most laboratories do the hepatitis B test. So it's quite available all over the place.
Okay.
Yes.
All right, so you were talking about making screening, confirmatory screening cheaper.
Yes. Yes, so if government also needs, I'm just going to give you an example. The tests used to cost on the average about 70 to 100,000. It was again the intervention of Roche that brought down the price. They actually donated the machine to some...
No, that's for you're talking about the other country now, but let's just focus
I mean even for Nigeria.
Okay.
The price coming down was based on the fact that some of these machines and reagents were donated to the labs. So they just charge mainly for replenishing their reagents.
Okay.
So government needs to actually come in and provide, support to make this test more widely available. I mean, in fact, they're actually available in only a few labs. So in some places, you may not actually have access to these tests.
Okay.
So it makes it difficult to
You
treat.
just said that if you, for instance, I want to have this test done, I can go to any lab.
No,
You know,
that is screening test.
Yes, because sometimes these laboratories too, you go to a lab and they give you some kind of wrong results and things like that.
Okay, actually that's a problem we have with our underdevelopment and, you know, the fact that the labs are not actually being well supervised. My advice is that if you are not very comfortable, because these tests are not really very expensive, they range from maybe 1,000 in some labs up to 5,000 in some labs. So they're not really very expensive. If you're not very comfortable with the result, you can check in another lab. There are some big labs where you can be sure that the results are fairly good. So you can go to those labs and check again, you know, to make sure that the results are good.
Okay.
Yeah.
Okay, so as we wind down, let's talk, you know, just what we need to do, and if I forget everything on this program, what should I remember?
The most important thing is that this is a silent disease. Don't wait till you fall ill. Go and get tested, know your status. These diseases are treatable. Very effective treatment is available. Although they may be expensive, we are hoping that government will come to the aid of the citizens by providing assistance in lowering the cost of the tests and drugs for treatment of the conditions. But this is with us. It's been with us for a long time. We should know it and we should confront it.
Thank you so much for coming today on the program.
Thank you very much.
And thank you all for watching at home. If you missed any part of this, you can watch online at youtube.com/channelsweb. I'm Yomi Otaigbe. Have a great day.